So my task in this role play is to explain to my patient Nikki how to care for her denture. This is the fit appointment, and she has just been given a full upper acrylic denture. Okay, so Nikki, have you ever had a denture before?
No.
Okay, so I'll explain to you how to look after your denture, how to look after your mouth, and everything that you need to do. So first of all, for the first 24 hours after you leave the surgery, you have to leave in the denture full time in your mouth. You only take it out just to brush your teeth. So you eat with it, you sleep with it. But this is only for the first 24 hours. And this is for you to get used to it. Because this is something new to you, it's something new to your mouth. You need time to get used to it.
Okay.
So after that, you have to take it out and clean it after every meal.
What?
Yeah, definitely. You have to clean it after every meal with a toothbrush. You have to give it a good scrub to make sure that there is no food stuck to the denture. And when you go to bed at night, you have to take it out and put it in a glass of water.
Really?
Yes.
Can I not sleep with it?
Nope, it's not a good idea. It's actually a very, very bad idea. First of all, you have to take it out because your gums need some time to rest. And also, if you keep it in at night, you might end up with something called denture stomatitis, which is a disease which happens in people who don't clean their dentures too well and leave them in at night. Okay. It's a fungal infection, so your mouth will become sore and painful, and it's not pleasant. But you can prevent that if you clean the denture quite well and you take it out at night and put it in a glass of water.
And if I clean it really well, can I leave it in at night?
Still not a good idea.
Yeah? Okay.
You need, it should be the last thing you do before you go to bed. Just leave it in a glass of water and you will be fine.
Okay.
It has to be in a glass of water because otherwise the material of the denture is going to change and the denture will be ruined over a long period of time.
And how long will the denture last for? What happens if my denture becomes loose?
Oh yeah, so your denture should last for a good long time. If the denture becomes loose, which is a possibility, you can use denture adhesives, which you can buy in the pharmacy. You can use those temporarily, and then you can come back to us and we can reline your denture. So basically the dentist is going to add a layer to your denture, to the fitting surface of your denture, so that when you put it in the mouth, it fits your mouth better and it won't move about.
Okay, so you can fix it if it does come
Yes,
loose.
it can. So for example, if you break it, again, come back to us and maybe it can be fixed. In some cases, we'll have to make you a new one, but in a lot of cases, the dental technician or the lab technician can glue it back together.
Okay, thank you.
But don't worry, getting used to a denture is a process. It takes some time, so it might take you a few days or maybe a few weeks, but you will get used to it. However, if you have a problem with the denture, if you feel that it is hurting your gum somewhere quite a lot, you have to call us, make an appointment, and you have to make sure that you wear your denture before you come, for a good few hours before you come, because then it's going to make a little sore on your gum, which is kind of unpleasant, but it will show the dentist exactly where the denture is hurting you, and then he can adjust the denture so that he will remove some of the denture material so that it fits better and it doesn't hurt you anymore.
Okay. So with the denture, can I still eat normal food, what I would eat on a daily basis?
Oh yeah, you can. At the beginning, while you're getting used to the denture, maybe you should try to eat a little bit softer food, and then you have to make sure that any hard food you cut up in small pieces. So for example, it's not a good idea to bite into an apple or to a carrot, which are quite hard foods, because it might move the denture. So it's best to cut it in small pieces. Try to avoid sticky foods as well, like toffees, for example, chewing on toffees. Chewing gum, not ideal because it might get stuck to your denture as well.
Okay.
So, but otherwise you can eat anything as you like.
Okay.
Okay, do you have any more questions?
No, that's all, thank you.